Children can enter the foster care system when they've been identified as being a victim of child neglect, physical or sexual abuse, and it's been determined through an assessment that they are living in an injurious environment. There are a number of causal factors that can lead to child abuse and neglect. Those include families that are facing insurmountable stressors and they're not coping well with those stressors, situations where parents are suffering with substance use disorders and mental illness, or there could be domestic violence in the household where the children are living. So each child that's entering the foster care system, their story is unique. What is common to all of them is that they've experienced some type of trauma or adversity, and they all need a safe and stable home where they can be loved and cared for. As you can imagine, there's a lot involved for planning for a child's care when they enter foster care. So the foster parent needs to be able just to respond to the basic daily needs of care. But beyond that, the child also has a number of appointments that they have to attend, like medical, dental, therapeutic appointments. And then it's really important that children are remaining connected with their parents and their family, and this includes their siblings, if they're not placed with their siblings. And so that takes a tremendous amount of planning and coordination. So the caseworkers that are involved in the case are going to work closely with the foster parents to talk about the child's needs and to plan and coordinate the necessary schedule to ensure that family time is happening, to ensure that children are getting to those necessary appointments. There are also opportunities for the children to be involved in extracurricular activities or things that really promote their well-being. And we encourage the participation of both foster parents and parents in those activities, and we will do that when it can be done safely. So there's a lot of planning with the foster parents on what that looks like and how it will be managed.
The highest need that we have is for foster homes to take in sibling sets and adolescents and youth, especially foster homes that are affirming of LGBTQ youth.
One of the greatest needs in our foster care system is people who can take a wide range of ages, because a lot of our sibling groups that come in are anywhere from like 4 to 15. And so someone who's willing to care for a 4-year-old and a 15-year-old, we don't have a lot of those people who are willing to do that. Obviously teens are a big one for us. We just always are gonna need homes for teens. But then also, we do have a significant number of kids with special needs that need parents who are willing to put in that work and effort to get them the services that they need. And the cool thing about the kids with special needs is most of them come with very big teams of people of support. There's a lot of resources in the community for kids with special needs that comes with that. Just having families who can jump into that group of professionals is so helpful.
In my mind, there's two big misconceptions about foster care. And one of them is that a lot of parents say that they can't do it because they don't want to get too attached. I guess I always say that the kids need us to get too attached. That's why we do it, is because these kids need someone to love them as much as their parents do and love them like their own. And if we're getting too attached, then we're doing it right.
Yeah, it's taken us some time to kind of learn how to introduce our friends and our family to that this is a part of our life. And some are very accepting, some are kind of awkward about it at first. Maybe taking it a little slower with some of our friends at first has been something we've learned along the way.
I'll say this too, our first placement, I was scared to death. And I didn't know what to expect of this kid that was gonna move into our house.
A teenage boy, and he was terrified he was gonna be just like this big kid. And
he was this small, cute, innocent kid. He's a kid, and so my anticipation of being challenging was not as bad as I thought it was gonna be.
A misconception that people may have about foster care is that children are legally freed for adoption, or that parental rights will be terminated and the child will be available for adoption. Our goal at the department is for children to always be reunified with their biological families. And when that can't happen, we are always looking for kinship homes as a second option.
One of the biggest misconceptions about foster care, I think, is that you have to be like a saint to do it, or someone who has like the most time in the world. And you do have to have the capacity and bandwidth to do it. We have really normal families who do it and who just make it work within their own world. We think they're just saints and amazing humans, but they're also just normal families that are just chosen to make this part of their lives.
I think the most rewarding is always afterwards. You know, we precious little baby we brought home from the hospital and had all these like firsts and experiences with him, and then sent him home, and his parents are doing so well and they're so healthy, and they send us pictures and we go to birthday parties. It's just amazing to see that afterwards, to see this healthy family reunited. And we've had a lot of teenagers in our home, and they'll, message us or, find us on Facebook, after they turn 18 and tell us how they're doing, tell us about memories they had with us. And I think it's that after. Sometimes it can be really hard in the moment. The after is really wonderful.
I felt adopted by some families, which is really kind of cool. They're an extension of our family. Some kids that you didn't realize you made an impact on at all until years later, and they contact you and let you know how much that we meant to them, which is cool.
I try to do things like, all right, what do you like to do? And we'll make a point to do that. Where places you want to go, we'll make a point to do that. Or just try different things, or we take them with us on vacation, or we do a lot of things that maybe they haven't done before ever, and that's just part of just trying to enjoy life. We had our first two kiddos. I was thinking, oh, what about these things we could do together? But they are just amazing kids, and you see the best of them, and you're looking forward to spending time with them and what you could do, talking with them about certain things and seeing their personalities come out. And they still call us, mom and dad at times if they want to. Even no matter what, we'll always be a mom and a dad to you. So whether you use the words or not, because that's what we share.
One thing that's really rewarding to me working with foster families is really just seeing them open their hearts and their homes to these kids. It's truly just a blessing to have our foster families working with the department and, again, just willingly taking these kiddos into their home and loving on them.
There are a number of both local and state resources accessible to foster parents during their fostering experience. Locally, they'll have the support, as I mentioned before, of the caseworkers and of the department. The state of Colorado also has a foster parent advisory council that is a great resource that provides support and educational resources to anyone considering fostering. There will also be ongoing opportunities for our foster families to experience support and training. We currently partner with the CASA program, who is a master practitioner of TBRI. So that's a great learning opportunity for caregivers who are really committed to caring for kids in foster care.
Some of the resources in the community, other than just being connected with the county and fostering for us, we obviously try and provide as much support as we can, but there's only so much. The access to each other, which is something we try and foster a lot, is just making connections within our foster families so that they can support each other. But then there's a bunch of community resources that don't even necessarily have to do with fostering that really do support our kids. So early interventions is one of them. The school district is actually, I feel like, a huge partner in what we do.
What's the Operation Foster Hope? They will get supplies, sometimes food, for families that just take a placement.
Little Willows brings like a box of clothes to somebody who just got a placement like that day. They'll bring like a box of clothes in whatever size the kid needs, and then when they've gotten out of that size, they'll just bring another box of clothes. And we get Christmas gifts every year from a church in Windsor. They do like an incredible job for our kids, and the community is just really behind foster families, which is just really cool.
I would say meet other foster parents, ask them questions, kind of build that community, because once you do have kids in your care, having that resource for respite, having that support system of people who have advice and know, how to handle certain situations or how to fill out paperwork or, is really handy.
I think Nike has really good advice for potential foster parents. Just do it. Maybe not for everyone, but I think it's healthy. It's healthy for a lot of people to take care of other people's kids, and nurture them and learn not to be so selfish, if I can say that. When you're taking care of children, you develop a different part of you that you didn't really have before. Just taking care of someone else's needs, it's good for you.
Know what your strengths and limitations are going into foster care and practice setting boundaries, because that's so important. And know when you need a break, and that there's so many resources that we have available to help you with respite care so that you can take time to also care for yourself or your partner, your family, whatever your unique situation looks like.
I would say take the opportunity, because if you don't, you will always wonder what it would be like. If you can make a difference in one kid's life, then life would be worth it.